Imagine walking into the AMC Clinical Exam station. You're confident, you know exactly what to do, and when the timer starts, you nail your history, perform a flawless physical exam, and deliver a sharp management plan. The examiner nods in approval. Wouldn't that feel amazing? Well, that's exactly what we are going to help you achieve in this video. We'll break down the exam format, high-yield techniques, and the biggest mistakes that cause candidates to fail. Most importantly, we'll cover the 2025 updates that you need to know before stepping into the exam room. If you're preparing for AMC 2, stick around. This video will save you weeks of trial and error and get you ahead of the competition. Let's dive in. So what makes the AMC Clinical Exam tough? It's not just about knowing medicine. It's about thinking fast, managing time wisely, and confidently interacting with real patients and examiners. Here are some of the biggest changes happening in 2025. The exam is now completely face-to-face with no more online options. Every candidate must attend a designated AMC center. The structure is changing. There are 20 stations in total, 16 assessed stations, 14 scored stations, and 2 pilot stations that won't count towards your score. Plus, you'll get 4 supervised rest stations to catch your breath. And here's the passing rule. You must pass at least 9 out of the 14 scored stations. That means you need to be strategic and consistent throughout the whole exam. This exam is designed to mirror real-world clinical practice in Australia. It's no longer enough to just talk your way through the diagnosis. You need to demonstrate your clinical skills in real time. Let's talk strategy. If you want to pass this exam, you need a structured, repeatable approach that works under pressure. And that's where the P.A.S.S method comes in. Step 1. Plan your time. Time is your biggest enemy in this exam. That's why you need to structure your responses effectively. Here's what you should aim for. 4 minutes for history taking. Ask open-ended questions. Cover red flags and summarize key findings. 2 minutes for diagnosis. State your top diagnosis and at least 2 differentials. The rest of the 2 minutes for management. Clearly outline investigations, treatment, and patient education. Most candidates spend too long on history and end up rushing through the time management. Don't make that mistake. Stick to the 4-2-2 rule and you'll stay on track. Step 2. Analyze like an examiner. Examiners aren't just checking what you say, they're assessing how you think. They're looking at 3 clinical areas. 1. Clinical reasoning. Can you connect symptoms, exam findings, and management logically? Communication and empathy. Can you explain things clearly and confidently without medical jargon? And 3rd, time efficiency. Can you complete all tasks in 8 minutes? Use structured communication frameworks like SOAP, which stands for Subjective Objective Assessment Plan, or an ISBAR to keep your answers crisp and professional. Step 3. Study the high-yield cases. Here's a fact. Most candidates fail because they don't focus on the right cases. If you're short on time, prioritize these high-yield topics. When it comes to chest pain, think about MI, pericarditis, pulmonary embolism. Shortness of breath, think congestive heart failure, asthma, pneumonia. Abdominal pain, think appendicitis, diverticulitis, pancreatitis. Mental health, think depression, anxiety, suicide risk assessment. Pediatrics, think fever in infants, dehydration, respiratory distress. And in the care of elderly, think fall assessment, dementia, and polypharmacy. Many candidates focus on rare conditions and ignore the common ones that are guaranteed to appear. Stick to the high-yield cases and you'll be ahead of 90% of the candidates. The final step is stimulate the real exam conditions. Reading books won't get you through this exam. You need real-world practice. Use a timer. Practice in 8 minutes block. Use real cases. Role play with a friend or mentor. Record yourself. Watch your performance and refine your answers. Get some feedback. Join a study group or take mock exam. Think of this like sports training. The more you practice under exam conditions, the more automatic your responses become. Here are the top reasons why candidates fail. Poor time management, spending 6 minutes on history and rushing through the management. Ignoring Australian guidelines, use RCH guidelines, NSQHH standards, and Australian therapeutic guidelines. Over explaining, stick to key points, don't waffle. Lack of patient education. If your patient leaves confused, you fail. How to fix it? Rehearse, get feedback, Time yourself, repeat, refine. If you do just 3 things, your chances of passing will skyrocket. Follow the P.A.S.S method. Plan, analyze, study, stimulate. Master high-yield cases and Australian guidelines. Don't waste time on rare conditions. Practice like it's exam day. Stimulate real condition, record yourself and get feedbacks. AMC Clinical Exam isn't getting easier, but that doesn't mean you can't pass. If you prepare the right way, you'll be ahead of those who don't. Drop a comment below. What's your biggest struggle with AMC 2? I'd love to help. Now go crush your AMC Clinical Exam.